Good day, I am Nova Mantayona Donato, and for today's video, I'll be conducting inserting a nasogastric tube. For the assessment, check the physician's order for insertion of nasogastric tube. Check for history of nasal surgery or deviated septum. Assess patency of nares. Determine presence of gag reflex. Assess mental status or ability to participate in the procedure. For the planning, identify the availability of needed supplies and equipment. Arrange for extra nursing personnel to help as necessary. Prepare equipment and bring preparation to the bedside. For the implementation, greet client, introduce yourself, and explains procedure in the client's level of understanding. Maayong buntag sa imuha ma'am. Ako di ay si Nova Mantayona Donato, ang imuhang student nurse karon. So, naaka karon ma'am, no, kay mag-insert ta og nasogastric tube, no, kini magamit ni siya, no, para insert, no, ang food or medicine, no, from gikan sa imuhang nose padulong sa imuhang stomach or sa imuhang tiyan. Identify client using at least 2 identifiers. Example, name and medical record number or wrist identification band, and ask client's full name according to agency policy. Unsa gani ang imuhang kumpletong pangalan, ma'am? Provide well-lighted room. Provide privacy by screening and closing windows and doors. Assist the client to high Fowler's position of his or her health condition permits, and support the head on a pillow. Place a towel or disposable pad across the chest. Apply clean gloves. Ask the client to hyperextend the head, and using a flashlight, observe the intactness of the tissues of the nostrils, including any irritations or abrasions. Examine the nares for any obstructions or deformities by asking the client to breathe through one nostril while occluding the other. Select the nostril that has the greater airflow. Prepare the tube. If a small bore tube is being used, ensure stylet or guide wire is secured in position. If a large bore tube is being used, place the tube in a basin of warm water while preparing the client. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the top of the earlobe to the tip of the xiphoid. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve downward into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. Direct the tube along the floor of the nostril and toward the midline. Slight pressure and the twisting motion are sometimes required to pass the tube into the nasopharynx, as some clients' eyes may water at this point. If the tube meets resistance, withdraw it. Relubricate it and insert it in the other nostril. Once the tube reaches the oropharynx or throat, the client will feel the tube in the throat and may gag and retch. Ask the client to tilt the head forward and encourage the client to drink and swallow. If the client gags, stop passing the tube momentarily. Have the client rest. Take a few breaths and take sips of water to calm the gag reflex. In cooperation with the client, pass the tube 5 to 10 centimeters with each swallow until the indicated length is inserted. If the client continues to gag and the tube does not advance with each swallow, withdraw it slightly and inspect the throat by looking through the mouth. If a carbon dioxide detector is used, after the tube has been advanced approximately 30 centimeters, draw air through the detector. Any change in color of the detector indicates placement of the tube in the respiratory tract. Immediately withdraw the tube and reinsert. Ascertain correct placement of the tube. Nasogastric tubes are radiopaque, and position can be confirmed by X-ray. If a CBFT is used, leave the stylet or guide wire in place until correct position is verified by X-ray. This is the only definitive method of verifying feeding tube tip placement. Aspirate stomach contents and check the pH, which should be acidic. Aspirate can be tested for bilirubin. Bilirubin levels in the lungs should be almost zero, while levels in the stomach will be approximately 1.5 mg deciliter, and in the intestine more than 10 mg deciliter. Historically, nurses placed a stethoscope over the client's epigastrium and injected 10 to 30 ml of air into the tube while listening for a whooshing sound. Secure the tube by tapping it to the bridge of the client's nose. If the client has oily skin, wipe the nose first with alcohol to defat the skin. Apply a commercial securement device. Cut 7.5 centimeters of tape and split it lengthwise at one end, leaving a 2.5 centimeters tab at the end. Place the tape over the bridge of the client's nose and bring the split ends either under and around the tubing or under the tubing and back up over the nose. Once correct position has been determined, attach the tube to a suction source or feeding apparatus as ordered, or clamp the end of the tubing. Secure the tube to the client's gown. Loop an elastic band around the end of the tubing and attach elastic band to the gown with a safety pin, or attach a piece of adhesive tape to the tube and pin the tape off the gown. Remove and discard gloves. Perform hand hygiene. Document relevant information, the insertion of the tube, the means by which correct placement was determined, and client responses like discomfort or abdominal distension. That would be all. Thank you.